Welcome to this channel. Myself Dr. T. N. Devnath. Today we will discuss one of the very important topic called blood smear preparation. How we make blood smear is very important. What is the use of blood smear preparation? Number one, if you say the use is number one is the PBS, is the peripheral blood smear, and number two is the bone marrow blood smear. In the peripheral blood smear, we see the RBC, WBC and platelet, RBC, WBC and platelet, okay, and we see the hemoparasite in the peripheral blood. It's very important, hemoparasite. In the bone marrow, we see the effect of radiotherapy and chemotherapy in the bone marrow, chemo and radio, and number two is the certain diagnosis, confirmation of certain diagnosis we done by bone marrow aspiration. So it is the confirmation of diagnosis. And combinedly we can say after doing the PBS or bone marrow examination, we can direct for further investigation to direction for further investigation. Direction of further investigation is very important. For this purpose we should do the bone marrow preparation and the peripheral blood preparation. So smear preparation is very important, because it is the primary requisite for bone marrow or PBS examination. We need the slide. So it has a manual method and it has a automated method. Both the method we can use, but we are very much fond of manual method. So we will discuss here the manual method. In the manual method, we can take blood from the fingertip, that is the capillary blood, and we can take from the venous blood. Okay, the most good or important things about the fingertip blood is that the morphology of the cell is very clear. The morphology of the cell is preserved, but here it is a EDTA mixed blood, so there are some changes in the morphology of the blood. So we can do both of that. For that we need how to prepare. So we need, for preparation we need some important things which I will mention here. For preparation we need, number one is the slide. Very important is the slide. If you see the slide here, the slide is already, I have drawn the slide. It is 75 millimeter into 25 millimeters in the length and breadth. If you see the height of this slide will be 1 millimeter. This is the very important, and that slide should be clean, dry and grease free. This is very prerequisite for the slide. It's a grease free. And number two, we need a spreader. What is spreader? Spreader is a specific slide which we use for the spread of the blood. The spreader, if you see, we have broken both the corner of the slide of one side of the slide. We broken both the corner of one side of the slide, and we have made that area at about 15 to 18 millimeter. Why we have broken this area is as important, because if you see the breadth of the slide is 25 millimeter and the spreader breadth is 15 to 18 millimeter. So when we spread the blood, so there will be some area, free area, there will be no smear, so that we can microscopically examine the edge of the smear. This is very important. That's why we made a spreader. And the spreader, the edge of the spreader will be very smooth. This is very important. It has to be very smooth. And the spreader we can reuse also after proper cleaning or drying. And number three is the blood drop. It is very important, blood drop. We call it as a small blood drop. What is small blood drop? If you see here, it is a small blood drop, and the usual measurement of the diameter of the blood drop is 2 to 3 millimeter. Okay, this is come after practicing again and again, that accuracy will come, and this is the very important for the slide preparation. So we'll go for the procedure. If you see the procedure, we just take a small drop of blood the importance of this blood drop we put in the slide, but see there should be minimum gap of 1 centimeter. There should be minimum gap of 1 centimeter. We put the blood drop and we put the spreader. In the spreader, it is very, very important to note the angle of the spreader will be about 30 degree, because accurately 30 degree it will be very difficult, but it is around the 30 degree or about 30 degree. That means it may vary here and there, but it should be around 30 degree. This is very, very important to remember. Then we draw back the slide so that the blood drop comes contact with both the slide. Then we come forward with a steady, smooth pressure. Okay, so that we made the slide. And here one of the very important point is that we should utilize, or the blood drop should be used up 1 centimeter. This is 1 centimeter prior the one end of the slide. This is very, very important. So we are left with 1 centimeter from here. We are left with 1 centimeter from here. And the length of this blood smear will be at around 3 centimeter. So this is very, very important for spreading and making the smear. So we have made the smear. The next two important point is the leveling. This is very, very important, because without proper leveling your report will be definitely wrong report. So leveling is very, very important. What we will level? We level the lab number. Very, very important. And number 2 is the date. How to level? We can level it either by lead pencil or by diamond pencil, and another is we can go with permanent markers. This is very, very important. With these three we have to level the slide. The most important point, another, where we should level. We should not level at the tail of the smear. No, we should not tail, because tail is very, very important for microscopic examination. So we will write or level here. The thick part of the smear we will level it. We will done the level here, so that it will not hamper the microscopic examination. So we have done the level. After the leveling, we have to go for fixation of the slide. Fixation is very, very important here. Fixation of slide, because without proper fixation, the smear will be peeled off from the slide. So we have to fix it. The most commonly fix it is by the methyl alcohol. And that methyl alcohol should be absolute methyl alcohol. There should not be any moisture or any water. Okay, it is the absolute alcohol, and we keep for 2 to 3 minutes so that it get fixed. But most importantly, what we see in the laboratory, they do not fixed. They do not fixed. Why they do not fixed? Because they have seen, it has been seen that the slide preparation, that is the smear preparation plus staining, if we done it within 2 hours, less than 2 hours, there is no need of fixation, because it will give the satisfactory result as automatically. And another important point is the when we stain with the Leishman stain. When we done with the Leishman stain has methyl alcohol. It also help in fixation. But here fixation is not so good, because that methyl alcohol is not absolute methyl alcohol. It attract the moisture. Once there is a moisture, there will be not very good fixation. Okay, so we have done the fixation. We have prepared the slide. Now, what is the good quality of slide? What are the quality for a good smear? The quality of a good smear is, number 1, it should be tongue shaped. Number 2, it should not cover the slide. It should left some area everywhere. Okay, so that we can examine the edge. It should have thick part as well as thin part with a smooth transition in between. Okay, and it should not be too short. This is very, very important. It should not be too short. Okay, so this is the very very good qualities of the good smear. And if you see, we have the ability to make the smear either thick or thin. It is in our hand, because in anemia there is a less hemoglobin, so automatically the smear we will make, it will be a thin smear, but we want a little thick smear. So what we can do, we can increase the angle of the spreader. We can increase the angle of spreader, and we can also increase the speed of spreading. Both these funda we can make thick smear. At the same point, in polycythemia, where there is more amount of hemoglobin and RBC, we want thin smear. So here we will decrease the angle as well as decrease the speed. So we will get a thin smear. This is very, very important to be remembered. And last but not the least, the point is, we want to reuse the slide. So what we can do for reusing the slide, it is very, very important. We have to do some protocol. Number one, we have to soak it with detergent powder. Soaked with the detergent powder at 60 degrees centigrade for 20 minutes. Is very, very important. 60 degrees centigrade into 20 minutes. After that, we'll wash it with a tap water, and we next rinsed with distilled water. And we make it dry, so that we can use it for the next preparation of slide. So we will save the slide also. So I hope this video has make you some important clues and important figure. It will ask as a Viva also. So it is very, very important in respect of PMLT student, DMLT student, even in some case of Viva in UG and PG. So if you like the video, if you got some benefit from the video, like the video and share the video with your friends, so that your friend also gets some knowledge and can utilize for his practice. Okay, thank you.